Good morning, everybody. Hello, hello. I'm Gina Capadu. I use she, her pronouns, and I get to be one of the program coordinators with Kids Mental Health Pierce County. I am very excited that today, as in partnership with Kids Mental Health Washington, I get to work with the fabulous Charlie Health to talk about some telehealth best practices. We're really glad that you're here, and we've got a lot of information that we want to cover. So I'm going to go ahead and get us started. Thank you so much for being here today. So if you could go ahead and drop in the chat where you're from, your name, and what some of the biggest barriers to care are that you're go ahead and get those started while I pull up our PowerPoint presentation. So thank you so much for being here. Happy to have you, and we're going to go ahead and get started. And here we go. Is everybody seeing my slides? Emily, Shannon, Brittany, can I get a verbal yes if that's working for you?
Yes.
Coming through.
Perfect. All right. Thanks, everybody. So hello for those of you that are just joining us. Again, my name is Gina. I'm with Kids Mental Health Pierce County, and I'm very honored to be in partnership with Kids Mental Health Washington, being able to partner today with Charlie Health for our virtual care real connection best practices for youth telehealth webinar today. Just a quick disclaimer, we are recording this webinar, so I just wanted to make that aware for everybody, and then we are going to record this and get this posted onto our Kids Mental Health Washington website so that people are able to go back and watch it again, or they're able to watch it if they weren't able to join us live. So thank you for being here today. A couple of things just to get us grounded. What we're hoping you take away from today are these learning objectives. So first and foremost, we want you to have more knowledge about the youth behavioral health care continuum. Secondly, we want you to be able to connect to your local teams, and that's both with your Charlie Health partners as well as your Kids Mental Health Washington regional teams. And last but not least, we want you to walk away with tools and strategies to create safety in the digital environment. And that's for the youth that you're serving, the youth that you're working with, and also as providers. So a couple of pieces today, we like to set the stage with some group norms just to get people to participate and understand how we're showing up today. We've got a couple of ways to engage. So first and foremost, we want to show love to folks when they're choosing to be vulnerable. So if they're raising questions or they want to get connected, that's wonderful. I'm always going to be assuming it's for good intent and that people are getting curious. I also know that I'm a person that likes to take a lot of space. I've got a lot of excitement and passion about these resources. So I'm a person that really practices on stepping back to make space for others. And then always, it's okay to ask for some context when you don't know about what somebody is talking about, because we're all learning here. Since this is a recorded webinar, you have the chat function that's available to you. You also have the Q&A, so we're going to be monitoring that space throughout this webinar. A couple of things to think about is for us, we're going to be doing our best to get through all the content and leave some time for Q&A. If we don't get through all of your questions or items in the chat, that's okay. You're going to be able to follow up with Charlie Health. You can always follow up with me with Kids Mental Health Washington, and we'll make sure that we engage with you that way. So for those of you that are just joining us, if you could in the chat, please write what county or state you're coming from, what system or space you're representing, and then the third thing is what are the biggest barriers you're seeing in care. That would be great. It's going to give us an idea of who's in the room. It's going to give you some contacts of people that you can connect to on your own. And then also it's just going to kind of create a space of what are some of these barriers to care that we're seeing. One of them is what we're going to be talking about today, about accessing the ins and outs of telehealth. So a little bit about Kids Mental Health Washington before I turn it over to our partner presenters today. What we really hold true is that youth do not have a single way of accessing behavioral health services that's going to work for everybody, because each of these youth exists in a different experience and a different system. And so for us, we know that it's going to really take a holistic approach, because all of these different capacities that you see on the screen are going to influence the type of access that youth and families have to behavioral health services and what kind of resources they're able to tap into. And for us, that's why I was so excited to see such diverse registration for people to come to this webinar today, because it really does take a partnership. And with Kids Mental Health Washington, we're really excited across the state to be able to work with all these different types of providers that are on the screen and then some, because we really do want to refer people to the agencies that you're working with. We want families to know about the great work that you're doing, and we want to be able to reach families wherever they are. For Kids Mental Health Washington, we primarily serve youth that are kindergarten through 12th grade across the entire care continuum. So Kids Mental Health Washington is a couple of things. You can access it regardless of insurance across the state. Again, for youth kindergarten through 12th grade, but we have served as young as 1 and as old as up to 25. And regardless of where in a state a youth lives or what kind of insurance they have, there's a couple of things that they will always be able to tap into. First and foremost, they're always going to have a referral process that anybody can access to be able to get requests for youth in need of support processed. And so that could be a parent, it could be the youth directly, maybe it's a school, maybe it's an emergency responder, but you're always going to be able to have a Kids Mental Health Washington website or team that you can reach out to get some current information and get some support. We also get to have behavioral health navigation that the teams will provide, where they walk right alongside the families to be able to find what kind of provider availability exists in the area, and really try to have resources that meet the needs of the family, whether it's behavior management strategies, family engagement, outpatient service navigation, whatever the need is, the family will have somebody to walk right alongside them, or the community partner that's trying to serve families in the community. There's going to be a website that's currently up to date so that you can find what exists in your community, regardless of where it is that you're trying to access those services. But for those cases where you've got maybe multiple systems involved or there's a lot of complex needs, we can convene with the youth and or their caregiver, what we call a multidisciplinary team meeting, where we bring the family with all the community resources together that's tailored to their ask, so that we can get really creative about what are clinical and non-clinical resources that we can try based on what the family's interests and needs are. And then they walk away with a contact and a face and some follow-up support to be able to make sure that they're not falling through the cracks post those meetings. And then last but not least, we really want this to be a community-wide impact effort. So each of the Kids Mental Health Washington teams across the state is going to have a local steering or action committee that's really coordinating those local resources to collaborate on community initiatives that that region has deemed as important to them. So that's just a little bit about Kids Mental Health Washington. It did start as Kids Mental Health Pierce County, and it has now, over a 3-year process, been fully implemented statewide in our partnership with Healthcare Authority and Developmental Disabilities Community Services. So I just wanted to share that one. And then if you are interested in getting connected to behavioral health resources, whether it's telehealth or other things, I'm going to drop in the chat what our Kids Mental Health Washington website link is. If you go to our homepage, you'll see a map very similar to this. All you got to do is click on the county where you're trying to access services, and it will take you to that regional team to get started. So that's a little bit about us. I'm going to go ahead and stop sharing, and I'm going to turn it over to our partners at Charlie Health. Thanks for today. So I'm going to turn it over to Emily, Shannon, and Brittany, and I'll let you know when we're able to see your screen. You're good to go. Thanks so much.
Hello, everyone. My name is Shannon. I am one of the clinical supervisors here. So today, Emily and I are going to be going over creating safety and connection in virtual treatment. So to start out with a little bit of introductions, like I said, I'm Shannon. I'm one of the clinical supervisors here on the West Coast team of Charlie Health. And I have specialties with trauma, mood disorders, anxiety, high acuity clients across adolescents, adults, and families. And then I'll pass it on to Emily so she can introduce herself instead of me introducing her.
Thanks, Shannon. Hi, everyone. I'm Emily. I'm a licensed clinical social worker and also a clinical supervisor at Charlie Health, and excited to be here today. But my career has mostly specialized in working with children, youth, and families with a focus on trauma and how our nervous systems respond to different things. Yeah, so excited to share some of our information about Charlie Health with you today.
So, as we said, we're going to be going into a little bit of the virtual treatment world. and talking and focusing a lot on what it means to create safety and connection in that setting, and specifically with Charlie Health and kind of how we navigate that. And so some of the learning objectives that we're going to be going over is we're going to look at how our outpatient therapy team, our clinical team, builds the therapeutic alliance in a virtual setting, understanding it, kind of like dissecting some of those complexities, and then identifying the tools and strategies that we use, and how we approach that kind of client to client. And then, of course, always exploring some of those barriers to this virtual programming setting, and addressing as much as we can, right, as we try to problem solve some of those barriers as well. And we'll kind of navigate through some different themes that we see, and then what we try to use to address those. So starting off strong, who is Charlie Health? So Charlie Health we are a fully virtual and remote IOP program. So we are an intensive outpatient program. Some of our mission and our vision and our values are here. So what kind of started Charlie Health and created the foundation is our mission of a world without suicide. And our goal was to how we connect the world to life-saving mental health treatment through a lot of, obviously, accessibility, which is kind of where the virtual world comes in. And then some of our values: connection, congruence, and commitment. Those are things that guide our clinical practice and our team camaraderie and just the approach that we have with our clients. So getting into intensive outpatient programming. So I'm not sure how familiar everyone is, but IOP is the level of care, I always say, just above kind of standard outpatient programming when you're meeting with that therapist once a week or maybe twice a week. And it is a structured form of the behavioral health care that we use to allow clients to get more services without, needing to obviously be in the highest levels of care or not be in their home environment. So our IOP includes group therapy, individual therapy, family therapy, and psychiatry. We do emphasize and focus a lot on the family therapy piece. It is not a requirement, but it's strongly encouraged, as we do see that as a high predictor of our success rates, and just kind of like even what Brittany was speaking to, every client showing up differently in their own environment. And so we try our best to try to treat the environment as much as possible. And then same thing with psychiatry. Psychiatry is also optional. We also work with a lot of outpatient psychiatrists and collaborate there if they're not enrolled in our psychiatry services. So our IOP groups and kind of like the clinical elements of the IOP program, the groups, we have many different cohorts and different treatment goals within that, and the clients also get to kind of move throughout their treatment with that same cohort. And so they build a lot of peer connection and, maintain those connections across with facilitators, and that really holds strong as a key indicator of IOP programming, like the group in involvement and what that provides for our clients. And then, of course, our individual therapy. So we do provide, we kind of do our best to match clients with therapists and based on preference and specialties and things like that. And so they'll get matched with that therapist. And then family therapy, of course, like I said, not a requirement, but strongly encouraged. And then our virtual IOP. So this is basically how we bring therapy to the client in their environment and allowing them to be in the comfort of their own homes, and ideally working towards whatever kind of schedule and flexibility is needed for them to be in their home as they're receiving services. And then I'll pass it on to Emily.
Thank you, Shannon. I'm going to talk about for a few minutes just what is different about virtual treatment, specifically IOP, what makes it unique, and just give you kind of a introduction into this world and how we create safety for our clients. So First thing, that I think is really important to talk about is what's the difference between the virtual space versus the physical space. And the very obvious difference is that when we move into this virtual place, we lose that physical connection with the people that we're working with, right? And so we call that the therapeutic container, like that connection we have and being able to connect with people both physically, emotionally, and things like that. So some of the things that we might lose is that environmental control, right? When a person walks into an office or a treatment facility, they're walking into a space that has some boundaries, some natural parameters around it. We lose some of that formality with that, right? Because people are meeting in their own homes or the space that they feel comfortable in. And potentially we're losing privacy, like that client's privacy, because when they walk into that physical space, we're able to contain that privacy, that treatment that we're providing with people. And a couple of other things that may happen when moving into a virtual space is, we may have to really be thoughtful about how we're using different clinical interventions and modalities. We need to think about the effectiveness and how we're utilizing those clinical tools. And technology, right? We've all experienced technology, so we have to be really considerate of a person's access to technology, ability to use it. But on the other side of that, there's so many opportunities here. With virtual treatment, we hear a lot about access, and reducing barriers to accessing care. And one of the big things that I think is often talked about is people who live in rural environments getting access to care, right? Virtual treatment really opens up many doors for individuals to come into care by reducing transportation issues, by reducing cost of getting to care, etc. But virtual treatment also reduces stigma. A lot of people have said that I don't want to go to a physical treatment facility for fear of people seeing me walk in or my car parked in the parking lot. We're also allowing people to reduce the anxiety that it takes to get to treatment, and opening those doors. When going to in-person treatment, a person has to get in the car or seek transportation from a loved one, which may bring in that stigma and that concern. They have to walk or drive or take public transportation. With virtual treatment, once enrolled, it's a simple click of a link to be accessing. We also do a lot of things to make that as easy as possible for the client by creating a care center where clients have access to all of their links for their appointments and sessions, links to all their documentation that they need to sign or that they want to have access to at any time. Other really lovely things is that we get an insight into the client's world, right? They're participating in the place that they want to participate in, their environment. And so the provider, the therapist, the group facilitator, whomever it is, can see what's going on in that person's world. And with all of those things, we often see that clients are able to increase their engagement with us because of a few things I'm going to talk about in just a minute. And then something that's really important to identify is our clinicians report greater well-being. They're in their comfortable environments. They feel safe and secure, which we know has a direct impact on a client's progress and a feeling of safety and care. When considering virtual treatment, virtual IOP, or any type of treatment, we really need to consider technology, right? Is it a bridge? Is it a helping thing for someone? Or is it a barrier? And we really try to address those things very early on with potential clients. First, we consider our virtual platform, right? We meet with clients via video, right? And so we make sure they have access to that. We also, as I mentioned, have that care center access where clients can access all sorts of things, as well as just simply being able to join in to a session. We also have to look at the things that might be keeping them from being able to access their care, right? First, devices. Not everybody has the phone or tablet or computer that allows them to access the internet and therefore access virtual treatment. So at Charlie Health, we provide devices for clients if they have that as a barrier. A really simple request where in a couple of days that we can get a tablet out to a client so they can engage pretty easily. We have to be mindful of their internet, right? We can't assume that every person has internet access. And so that is a big barrier that we have to address. But with reliable internet, a person can come from the safety of their home or the safety of a space that they choose. We have to ensure that clients know how to utilize the systems and platforms that we use. So we provide orientation to that, which Shannon will talk about in a little bit. But we want to make sure people feel comfortable, first of all, just accessing the care, the physical act of accessing. And then we have to assess that people feel like they can trust digital access. They can feel like they trust the platform, that they trust Charlie Health or whomever their virtual provider is to keep them secure, right, in this age in this digital age. We also have to make sure that we're creating a confidential and secure space for the client. And so that means really early on and regularly setting expectations for the client, asking them to really prioritize their confidentiality and prioritize their security within the space that they're meeting with us. We're constantly assessing that and looking at that and helping clients to identify when there may be a confidentiality concern, when there may be a safety concern in their environment. And helping to address that barrier right away so it doesn't become a long-term barrier to them being provided with good care. Now the good stuff, right? What happens? What do we see happen when people are able to connect virtually? We see that it creates a great deal of comfort right away, pretty quickly, right? Clients are able to build rapport because they feel comfortable in their space. Clients are able to trust, remain at ease. And so that unlocks them being able to share and disclose information with us, participate more fully in their treatment. Some other things we're able to do, we're able to create continuity in their care, right? Clients are able to regularly meet with us. We're able to meet with them throughout a lot of adverse situations or just difficult situations, right? If there's flooding, right? As long as your internet's not impacted, you can still come to virtual care. If you're going to grandma's house for the week and she's still in the state of Washington, you can still go up to your treatment, right? So there aren't those barriers. No matter what part of the state of Washington you're in, you can come. I talked a little bit ago about getting to witness the real environment, right? The providers at Charlie Health get a peek into the life of our clients, right? So by letting go of that formality I talked about a little bit ago, we're able to engage with the client and connect with them while they're in their space. And it gives us a really amazing opportunity to encourage and engage with them and encourage them to utilize these skills or think about these things in the environment that they're in, where they're going to practice this, where they're going to think about these things in the time between their treatment sessions and after their treatment. We do have to create a lot of structure in the environment, right? We want to create structure, again, from the beginning continuously throughout their treatment, we're working to engage clients, right? How do we look and see that someone's engaged in treatment? Are they looking at our screen with us? Are they being distracted by other things on their screen, by other things in their environment? And really importantly, we have to make sure and ensure and continually assess that they're in a private space, right? That privacy is really important for them and the success of their treatment, but also considering when they're showing up for our group sessions, that they are respecting not only their own privacy and security, but those of everyone else who's in that space.
All right, so I'm going to jump in and we're going to talk a little bit about the specific ways that we try to build some of those environmental, relational, structural safety that Emily was just speaking to in our virtual space. So when we look at structural safety and we kind of think about what structure means to a client, what that means for us, as Emily spoke to a little bit, we do offer an orientation at the beginning of clients' time in treatment. That is something that we do require them to attend, where we can go over a lot of what to expect with the virtual platform, how to navigate the systems that we use, their care center that Emily also spoke to. And then, things like confidentiality and limits to confidentiality, how they can navigate going through their sessions and their care team, get those introductions to everyone that they're going to be working with, and just overall kind of program norms and expectations. And then, we also look at scheduling. A lot of times we talk about change is inevitable, and scheduling and consistency there is something that we can maintain and provide. So making sure that client schedules are consistent week to week, but flexible. So we do offer the ability to move schedules around if, now my class time is moved, and so I need to move my sessions and things like that. But we look at maintaining the consistency that we'll still be meeting with you each week, and that they can expect to still have those groups, have those sessions each week. And then, of course, our favorite is accessibility and flexibility. So as we talked about, the ability to meet kind of anywhere and everywhere, and assuming that we can provide those things like a safe space and that environment, but allowing that flexibility for whatever comes up, right? The scheduling issues or whatever else might happen, not limiting clients when they have different demands or appointments to attend and things like that. We can allow for that. And then, of course, communication. So the communications with the client. So the clients sort of like reaching out to us, and also how we reach out to them. So the access to their therapist, their group facilitator, their group support, and the care team support. So we do have that 24-hour Charlie Cares line that they can contact, and then that kind of directs them to whatever department that they might need, whether it's like finances, the crisis team, their care team, and just allowing for that communication for the clients to ensure that we're providing that same, as much as possible, that same sort of structure of the program, that they're with us, and they can reach out to us with whatever concerns that they might have. And then kind of like I spoke to, crisis. So we do have that crisis intervention specialist team, and how we sort of screen for that and assess for that, as well as provide those services. And then in those moments, we have the number that they can call in the crisis, but also, if it's something that's not crisis related, reaching out to that care team support and then getting transferred to crisis if that's what ends up happening. So we do provide this sort of like overall structure that we can to ensure that the clients feel cared for and accounted for while they're in the program, even though we are losing that physical environment. And then the next one is on relational safety. So relational safety is, there's a few different ways that we kind of look at this. So with individual therapy, right, with the therapist, in those first sessions, we're looking at Of course, introductions, kind of going through what the client can expect throughout treatment, throughout sessions, and of course through goals, our goal setting. So we do an initial treatment plan with the client, and that is a very collaborative process, which allows for transparency and kind of mutuality in what the client and the therapist agree to be working towards while they're in the program. And then, of course, the primary therapist awareness, looking at, as we do get to see the client in their environment, what's happening in their world. Are they, sitting in that dark space in their room? Are they up and folding laundry? Are they doing whatever else that's kind of going on in their world? And kind of assessing that and being aware of that. Always looking at kind of attunement language for ourselves too as clinicians and how we show up in our sessions, and modeling that, of course, for the clients as well is important for us. And then, of course, we again strongly encourage having the camera on. So those challenges with the cameras being on and off, and those moments, we do try to encourage that, and that provides us to kind of, again, be modeling it, but also assisting and holding those clients accountable and having kind of like that shared space. We are both showing up here and let's have the camera on and, assess environment. Of course, a huge piece of that is also ensuring that we know where they are located and can ensure safety in their immediate environment as well. And that also is some of those things that we go over in orientation and we talk about in those first sessions so that we can always like reflect back to that when it comes, if and when it comes up later on. And then, like we said, physical and environmental safety. So we do know that we can't control the environment that they're in. So we do a lot of coaching with clients, kind of like what Emily was speaking to. We talk about that commitment to ourselves for the clients to ensure safety, ensure it's a confidential space, and having that privacy. And, with the ease of flexibility in mind and allowing for clients to kind of join with wherever they're at. We, of course, can see different types of distractions or different challenges. And so using those as also discussion points, right? If it is a continuous challenge in sessions, how might we address it and highlight that to the client to kind of reroute them back to their goal of showing up here for themselves and, ensuring that safety. And, of course, looking at the possibility for that lack of privacy. So, someone walking in on accident and those kinds of things on the client's end, we always want to, talk through that and assist the clients, like we said, coaching them on how to provide that safety for themselves, right? Post-its on the door, whatever little fun way we can come up with to provide that safe space as much as possible. And then, because we're not in that physical presence of the client, we do always ensure that we have, those safety measures in place, which is where it comes into asking the client their location, ensuring we have that location on file. If it's an adolescent or a minor, we're looking at who's the adult at home with the client, those kinds of things, and always ensuring that we can ask them those questions and be aware of that going into sessions at the beginning of each session, groups as well. And then, of course, emotional safety, one of the, important ones, and looking at what individual therapy provides. We want to also look at, is this a safe space to discuss emotions and to, allow ourselves to go in that meaningful emotional realm for the client.
Thanks, Shannon. So I want to talk a little bit too about how, what does that really look like, creating that connection across the screen, and really thinking about what is going on during those treatment sessions. How does the primary therapist be present and attuned to the session and to the individual client? One thing that we really have to be mindful in a virtual place is that we are free of distractions ourselves. right? And that we are attuned to the screen right now and communicating that, right? Through our verbal communications, but also our nonverbal communication. So that really means making eye contact with the screen, right? Really looking and engaging with that client for a few reasons, right? What that allows us to do is that allows us to attune to them, to be able to see those minor shifts in body language, to look at their environment like we've talked about, and to really just notice what is happening with that person and their world. Um, we also really want to make sure that we're thinking about simple things like camera placement, right? We want to make sure that the client can see us fully, that we're lighted well. All these sorts of things that seem minor, but really make a big difference in how the client is seeing us and being able to connect with us. We want to make sure that our backgrounds aren't distracting. We may be using, if needed, muted, calming virtual backgrounds. Um, Sometimes we'll see ourselves being exaggerated in our own body language, right? I'll often be nodding my head a lot more than I would if I were in a room with you, right? I may exaggerate my hand motions or different sorts of my presentation, right? So that so I'm connecting and that individual can feel connected to me, right? But also, what am I communicating to them? That I'm with you right now. I'm not being distracted from these other things that may be in my environment. Shannon spoke a little bit about too the collaborative process that we create, right? Since we're not in the room with the client, we are really actively, dynamically collaborating with them from the beginning. And that could really mean screen sharing, it's mutual goal setting, it's meeting the client where they are right now, right? What's brought you here? Not what do I think has brought you here, but what do you want to be focusing on? And sometimes that means, a lot of times that means us being really thoughtful about our presentation, providing intentional pauses, checking in with the client, right? To see, are you feeling okay, right? I might, like in person, I can notice some things, but I may need to softly check in more regularly. And just with any virtual or in-person space, we're creating time and space that's meeting the client with where they're at, giving them permission to lead this process, allowing them to allow us to use our expertise and to connect with them so that they feel safe. In virtual treatment at Charlie Health, we utilize a lot of different approaches and strategies. So we use many evidence-based modalities to treatment, but some that we use a lot include cognitive behavioral therapy and dialectical behavior therapy. We also use a lot of motivational interviewing in our work with clients to say, where's your readiness to participate in this? What's your readiness for change? Where is it that you're hoping to be in 9 to 12 weeks after you're working with us? We also used a measurement-based care system that really includes the client and really drives our work with them. So it consists of like mental health check-ins on a weekly basis that the therapist and the client are able to dynamically review and see progress or lack of progress, really investigate what's going on in the client's life. And then once again, we get to pull in that environment. It's a little bit easier to pull in that environment because I can say, oh, your sleep has decreased this week. What do you think? Can you look around your bedroom that you're participating in? Let's look at your bedroom and talk about what's going on there that might be supporting or not supporting your sleep, right? And I can pull in that environment to this evidence-based care. Shannon talked about family therapy. We really value family therapy here at Charlie Health. We think it's probably one of the biggest indicators to success. It's not required, but it's really, really, really strongly encouraged. And the great thing that we can do in a virtual place is it's accessible, right? So family therapy can be me and mom sitting on the couch together, sharing a screen. Great, wonderful. But it also can be me and my spouse who I'm separated with, who lives in a different location, who can also join that session virtually. It can be me as an adult with my adult parent who could even be in another state, right? To help me get some insight on what's going on, to help them support me. Other really regular prioritizations for us are safety and stabilization for our clients. We are doing regular safety screenings from day one of a client entering our care. They are done regularly, formally and informally, for clients who have identified safety concerns, but also for clients who don't have necessarily identified safety concerns. Hopefully, as we build that rapport, if there's something they haven't shared with us yet, that they're sharing it with us. And we have living safety plans. What do I mean by living safety plans? Safety plans that we develop with the person, that we will reference throughout treatment, that we will add to and edit, that we will share in those family therapy sessions, that we will reference as you come closer to discharge, that we will make, a part of your life, not just a document and a box that we're checking off. And like we talked about, that care center, clients always have access to this, right? And so they can refer to it, and we're encouraging them to, right? Who's on your safety plan? Who's the support you've identified? Do you want to share this with them? Can they come into family therapy for a little bit and talk about this, right? In a virtual place, we get this opportunity for collaboration and consultation that I'm not sure we have a lot of times or is as easy. Obviously, the family therapy that I just talked about, but within our system, we collaborate with our internal providers a lot. A group facilitator or psychiatric nurse is only a quick message away, right? So collaboration is really, really available. Those doors are so wide open. We collaborate on those treatment plans and we provide consults. We can share, as a group facilitator can easily message a primary therapist and say, hey, Emily, I recognize this during group session. It may be something you want to be aware of. I've had lots of conversations and consultations with our referral sources, outside providers. Obviously, we can do that through emails, through phone calls and things, but we can also create quick virtual meetings with providers. And then we have a robust discharge planning team that we collaborate with from really early on with our clients, to help them identify what are they thinking about their treatment after they leave Charlie Health, right? Do they want to continue in the virtual space or do they want to go into an in-person treatment? How can we help you get connected, right? How can that discharging plan really tailor your aftercare to meet your needs? And then one of my favorite pieces is that we get this feedback. It informs what we do with each individual we work with. We can informally check in with clients during individual sessions, have check-ins during groups. Those things are lovely. But we also have some more formal processes where we ask clients if they feel like they're being respected in their sessions, that they're being able to focus on the things that they want to. We allow for regular surveys to share feedback about the pros and the cons of treatment. And that removes that discomfort of sharing things, right? And allows us to really address it, prevent further ruptures in relationships, hopefully repair situations. tell our providers they're doing things well, that their clients really appreciate them, right? And then we're always using that measurement-based care, those mental health check-in results to see, how's a client improving? Or if they're not improving, what's going on? How can we utilize that to say, what can we do differently, right? We often will engage the client in that conversation.
Okay, and then we're going to go through, I'll do my best. I know we're probably closing in on time soon, but I'm going to go through some common challenges and barriers and our best attempts to problem solve. So kind of going through looking at some of those as disengagement, understanding that for us, disengagement is not compliance. Disengagement might mean other different things. So how can we, again, help problem solve those barriers if it is disengagement due to not having the confidential space? How can we coach the client through finding that and those kinds of things? High risk concerns. So trying to ensure your safety across the virtual platform. So we do have a high acuity care team. The clients can be enrolled in that kind of program, if you will, on a week-to-week basis. We assess the need and we allow for that additional support from the high acuity care team. And then any substance use issues. So we do have our substance use specific program, and we collaborate with what is called You Are Accountable, which is essentially a virtual at-home drug test and things like that, and the clients can, choose to be enrolled in to assist with maintaining sobriety. And then any distrust of virtual care. So really meeting the client where they're at, talking through those, understanding it with them, and ultimately using that to help guide the client's goals with the program, assuming that that's something that they're going to be maintaining with us. And then looking at kind of some other considerations. So we do always want to use kind of this framework to understand different approaches and how we might address them. So of course we have kind of the differences in developmental stages. So is this a client who's, 11 years old, or is this a 40-year-old client that I'm working with? And, what's the barriers there to technology or the virtual platform? The desire to be here. I'm sure we've all experienced that. What are those motivating factors for what brings a client into treatment? Diagnostic factors to consider, the impact of trauma on this virtual platform, those attachment wounds, trust, and again, emotional safety. And then any other considerations that we've talked a lot about, but those, technology issues or, some of those other distractions that some people might have in that world. And then looking at how we address all of those as much as possible. So we do really emphasize a lot on a strengths-based approaches. So really pulling strengths and interests into the conversations. Again, going back to that collaborative treatment planning. What was the client's goals for there? What is the reasons for being here? And then meeting them where they're at with that to ensure that they can kind of reorient to those goals for themselves and, align with them as much as possible. And then we really work to avoid assumptions about resistance or labeling clients as resistant. And again, just looking bigger picture, kind of like widening the lens on what are those other things that could be going on. And then of course, always slowing down and acknowledging that this process takes time and that there is no, direct line to achieve that. Emily, you're on it with when to switch slides. And then we're looking at some specific children and adolescent barriers and challenges. So, of course, we kind of have that the clients come in, that parent placed them, or again, they might just be untrusting of other of treatment in general based on past experiences. Those that seem really disinterested, not investment, we call those the push and pull. Those clients that are just less verbal, which, there's a lot of different factors that might play into that we want to look at too. Any kiddos that are neurodivergent, and kind of like assessing that appropriateness, ensuring that this is still an appropriate platform for them. And then, those distractions that we talk about, video games on the side or whatever else might be going on, and how we try to address that. So with that, we do look at kind of how using our platform as much as we can. So how else can we engage non-verbally? A lot of times, you know, especially in our super technology world, right? We have access to a lot of different things. So we do look at games or visuals, whiteboards, things that we can do where maybe we're not you know, just discussing, just having talk therapy with those clients who are struggling with different things. You know, I don't know how familiar everyone is with all the fun tools that everyone has, but I just found out about the whiteboard when I started working here. So the whiteboard's super fun, right? Kind of collectively with the client looking at how to get a little creative, and again, meeting the client where they're at and not forcing any kind of specific approach or sort of like clinical goals onto those sessions, but joining them and then with them trying to kind of use those strengths to engage with them in a different way. And then, of course, especially with our adolescent kiddos, like involving the support system if that's appropriate. Sometimes for our younger kiddos, that does look like having mom or dad in the room for, you know, 10-15 minutes or whatever the case is to kind of ensure some of that support and engagement in the platform, assuming that all you know, schedules allow. And pass back to Emily for our final slide. I think we did it on time. Wow, pretty good.
So I'll just briefly say, you know, creating safety in a virtual world is not a stagnant thing. It's something that we are constantly engaged in through assessment of what's going on with the person themselves and in their world. We never assume that safety is present, even if everything has seemed safe and wonderful for the last 7 weeks, right? We really have to stay attuned to that every time we meet with a client, and even when we receive other sorts of communications. But we've, you know, found through the use of a lot of tools, a lot of collaboration, a lot of supports, we can create a safe environment. And oftentimes it's easy to create and maintain. But when it's not, we can be open about that. And we can say, okay, where do we need to look at this? What do we need to identify? What can we change? We're here to do it. We're flexible. We're open to it. Because really, at the end of the day, it's what the client needs right now. And we want to help them provide that or receive that.
Okay, hi everyone. Are there any questions for the clinical team? Okay, cool. We can go to the next slide. I just wanted to quickly introduce myself. My name is Brittany. I'm a clinical outreach manager for Telehealth. I am local. I happen to be based in Tacoma, but we have cool people like me all over the state. So we would love to connect with you. If you have any questions, please do not hesitate to reach out. I did want to throw a couple of quick facts in the chat. So it's a little bit of a paragraph, bear with me, but just some key notes about our program at Charlie Health. We are, as mentioned, 9 to 11 hours a week, average of 8 to 12 weeks. We have no wait lists. We can get clients into care within 24 to 48 hours pending their verification of benefits. So we know that when folks need support, they need support quickly, and that's really our goal, is to get them into care as quickly as possible. We do support ages 8 to 64, so we can be a full family support system. We have had parents and kiddos go through program together. We've had, you know, siblings go through programming together. And, you know, our goal is really to figuratively virtually wrap our arms around the entire family. We accept almost all commercial insurance plans, all Medicaid MCOs in Washington, and TRICARE. We have lots of additional wraparound support, care coaches, parent caregiver support groups, 24/7 crisis support, alumni groups, on and on. We can be really flexible with scheduling. We do have weekend sessions, as well as morning, afternoon, and evening. And we can coordinate with existing providers as long as we have the ROI on file. And then the last thing to note is we do have specialized curriculum and cohorts for different groups within our program. So we have an LGBTQIA plus group, we have a BIPOC group, neurodivergent groups. We also have maternal mental health. We treat substance use disorders, we treat eating disorders, we treat male trauma, and there are more groups as well. So just wanted to include all of that information as well. Patricia, I see you have a question. Can you work with folks, grandparents over the age of 64? We cannot admit them into care, but they can be involved if they have, if they're a caregiver for a kiddo or another adult even that's in our program. They can be a part of not only our family therapy, but also the caregiver support groups that we run for families that are within IOP. Hopefully that answers your question. All right. If there are no other questions, I just want to quickly thank Shannon and Emily for everything. And Gina, thank you so much for having us. We appreciate you so much.
Wonderful. I'm also seeing in the chat some interest for other topics, including maternal mental health. So that's something that, is it Leica? I hope it's Leica. I hope I'm saying that correctly. If that's something that you and I can connect with, I'd love to talk more about that piece. But I just want to give a huge shout out to Emily, Shannon, and Brittany for bringing this information forward today. Thank you very much. So I'm going to just put an evaluation form in the chat here really quickly. And this is going to take less than a minute to be able to complete. It's just giving us some feedback about how this webinar experience was for you today, so we can keep improving and bringing things forward for free to all of our community members and community partners. Another thing I'm going to drop in the chat is I'm going to put my email in the chat. So if anybody has any questions for any kind of follow-up, they want slide information, you're absolutely welcome to reach out to me. I know Brittany's information was already shared, so I just want to make that available as well. So with that, I think that's everything that we have today. I see that there's already connections happening in the chat, which we love. So thank you everybody for being here today. Thank you to Charlie Health for presenting with us, and everybody take care. Bye all.